Hello, my name is Shalmia Brown, and today I'm going to teach you how to do a manual blood pressure. You're going to need a stethoscope and then a manual blood pressure cuff. Before we get started, I'm going to tell you a few things that you need to know before you take your first blood pressure. Make sure that your patient doesn't have a thick coat like this on, because if you try to wrap your cuff around their arm, you're not going to get a very good reading. So you want to have them to take that off and just have like a short sleeve or something really, really thin. So let's talk about what the numbers should look like for blood pressure. A normal blood pressure is 120/80. Your top number is your systolic blood pressure reading number, and that measures how much pressure your arteries. The maximum pressure of your arteries is when your blood is pumping through your heart with each heartbeat, and then your bottom number is your diastolic, which is your minimum pressure on your arteries as your heart's beating. So to get started, just make sure the hair and everything's out of the way, and you're going to want to put your blood pressure cuff on 1 to 2 inches above the elbow, depending on your patient. Usually it has a little guide on there to show you where it goes on the arm. So you want to not put it too tight but not too loose. You want to be able to put like 2 fingers in there, and that way you get an accurate reading. So before we get started, I'm going to feel for her pulse and just use the bulb on the blood pressure cuff, and I'm going to feel her pulse and then pump this up, and I'm getting an estimated value of what her systolic pressure is going to be. So an example of that would be if I stop feeling her pulse at 100 on the meter, then that means that when I take her actual blood pressure, that I need to pump it up 30 past that. That way that gives me a little bit of wiggle room to find what her actual blood pressure is. If you just guess on what to pump it up, you might miss the pressure value if her blood pressure is really high. So I'm going to do that now. You don't need your stethoscope for this part. Okay, so I stopped feeling her pulse at 120. So we're going to let it back out and just let her sit there for a minute before we actually take her blood pressure. Okay, so put your stethoscope in your ears, and then you're going to place your stethoscope on your brachial artery. And then when you're getting your blood pressure reading, when you first hear the heartbeat, that's the top number, and then when you don't hear the heartbeat anymore, that's your bottom number. And if you mess up and you let the air out too quick, you can always pump it up again. You don't have to start completely over. You can just pump it back up. So her threshold number was 120, so we're going to pump it up to 150. That's 30 over. And then that's where we're going to start listening for her blood pressure. You want to just let the air out real slow. If you don't hear it the first time, just pump it back up and then listen again. Sometimes it's hard to hear. Our top number is 130. And I'm going to listen for when the heartbeat stops. So our bottom number is 82. So some symptoms of high blood pressure would be confusion if they feel fatigued, and then low blood pressure you got to watch. They can feel confused, have weakness, dizziness, and just don't feel well. Either scenario, you just want to check the blood pressure and see what that number's at, just to get I don't know, just to see what you might do. If you need to call an ambulance, you can tell them what blood pressure you got, and that can just help them get an idea of what the patient's feeling like and what their blood pressure looks like.